Hello, Dr. Quijada, and thank you for taking the time to watch my presentation. I really enjoyed learning about anxiety for this project, and I hope this overview of generalized anxiety disorder helps show what I've taken away from this week's learning. As I mentioned, I'm going to talk about something that a lot of people can relate to, including myself, whether personally or through someone we know, which is anxiety. More specifically, I'll be focusing on generalized anxiety disorder, or GAD for short. I'm going to go through what it looks like, how common it is, how it affects people's lives and families, and what kinds of treatment options are available. What is generalized anxiety disorder? According to the DSM-5, someone with GAD experiences excessive worry or anxiety most days for at least 6 months. And it's not just occasional stress, it's hard to control and it affects daily life. To be diagnosed, adults must have at least 3 symptoms, and children must have at least one, such as restlessness or feeling on edge, getting tired easily, difficulty concentrating, irritability, muscle tension, trouble sleeping, etc. So it's a mix of mental and physical symptoms, not just overthinking or quote unquote being dramatic. Prevalence. How common is generalized anxiety disorder? Anxiety disorders are super common. About 30% of adults will have one at some point. With GAD specifically, about 12% of US adults are affected each year. That means in a room full of people, someone is likely living with anxiety, even if we can't see it. Also, studies show women are more likely to be diagnosed than men due to both biological and social reasons. Implications. How does generalized anxiety disorder affect people? Generalized anxiety disorder impacts more than just emotions. It affects everything from school to relationships and much more. People may struggle with sleep, headaches, stomach problems, or just feel exhausted from being tense all the time. It can also strain families. Loved ones may not understand what's going on, which can cause distance or frustration, and often GAD comes with other challenges like depression or substance use. So some of the symptoms of anxiety that I mentioned or I failed to mention are fatigue, rapid heart rate or shortness of breath, restlessness or feeling on edge, and difficulty concentrating. So treatments. I am going to start with the psychological therapies that I learned this week. One of the best ways to treat generalized anxiety disorder is through therapy, especially cognitive behavioral therapy or CBT. CBT helps people reframe anxious thoughts and gain tools to manage worry better. Other helpful approaches include mindfulness, exposure therapy, or psychodynamic therapy. Depending on the person, the main thing is that talking to a professional can be really, really life-changing. So, treatment and having to do with medication and lifestyle. Therapy definitely can help, but sometimes medication is also needed. Doctors often prescribe SSRIs, which are selective serotonin reuptake inhibitors, or SNRIs, which are serotonin norepinephrine reuptake inhibitors, which balance brain chemicals which are involved in anxiety. They take time but can be very effective. Lifestyle also plays a big role. Regular exercise, good sleep habits, reducing caffeine and alcohol intake, practicing relaxation techniques are all examples of what can help manage anxiety. Managing anxiety usually takes a mix of these strategies and not just one of them. So some of my key takeaways to wrap everything up: generalized anxiety disorder is a real condition, not just overthinking. It affects millions of people and those around them. But the good news is that it is treatable. With things like therapy, medication, healthy habits, and healthy environments, people can and they do get better. Thank you again for watching. I appreciate the opportunity to explore this topic and the other psychological disorders this week, and I'm looking forward to hearing your feedback. Thank you so much.